He was not hiding in the shadows. He was not lurking in dark alleys. He was sitting in your living room, drinking your tea, listening to your heartbeat, and deciding whether you would live or die. Because a doctor knows everything about you. Your age, your weight, your illnesses, your fears. He knows when your body is weak. He knows when you are vulnerable. And most importantly, he knows exactly how much you trust him. For the people of Hyde in Greater Manchester, that man was Dr. Harold Shipman, a respected family doctor, a trusted professional, and, investigators you'd later discover, potentially the deadliest serial killer in modern British history. Between 1975 and 1998, Shipman is believed to have murdered more than 200 of his own patients. Not on dark streets, not in hidden rooms, but inside ordinary homes, with a syringe, a death certificate, and a calm, reassuring smile. June 24th, 1998. Hyde, Greater Manchester. The home of Kathleen Grundy, 81 years old, former mayoress of Hyde, a woman described by everyone who knew her as sharp, active, and in excellent health for her age. Dr. Harold Shipman visited her that morning. He told her he needed to take a blood sample for a study on aging. She let him in. She made him tea. He left. 3 hours later, Kathleen Grundy was dead. Shipman signed her death certificate himself. Cause of death? Old age. Her daughter, Angela Woodruff, was a solicitor. She had always handled her mother's affairs. She buried her mother and returned home. And then a phone call arrived that changed everything. A solicitor she had never heard of informed her that a will existed in her mother's name. A will that left Kathleen Grundy's entire estate, £386,000, not to her family, to Dr. Harold Shipman. Angela Woodruff was a solicitor. She had spent her career reading documents. The moment she saw the will, she knew. The typing was wrong. The wording was wrong. The signature was wrong. Her mother had been meticulous about paperwork her entire life. This document was not her mother's. This document was a forgery. And the man who had forged it had also, she was now certain, murdered the woman whose name was on it. She went to the police, and 23 years of killing finally reached its end. Long before Britain knew him as the Doctor of Death, Harold Shipman was a quiet boy growing up on a council estate in Nottingham. Nothing in those early years suggested that one day he would become the most prolific serial killer in modern British history. But there was one moment, one relationship, that people would later return to again and again in an attempt to understand what Harold Shipman eventually became. His mother, Vera Shipman, was the centre of his world. She treated him differently from the other children. Special, smarter, better. And when she was diagnosed with terminal lung cancer, Harold watched her die, slowly, inside the family home. Every evening, doctors arrived carrying morphine. And every evening, Harold watched what happened next. He watched pain disappear almost instantly. He watched suffering fade. He watched fear become calm. But more importantly, he watched the person holding the syringe become the person in control. The person with absolute power over pain, comfort, and death. Vera Shipman died in 1963. Harold was 17 years old. And decades later, investigators would still wonder whether something inside him had attached itself permanently to those moments beside his mother's bed. He qualified as a doctor in 1970, Colleagues described him as intelligent, hard-working, and deeply confident, sometimes to the point of arrogance. By 1974, he was working as a GP at the Abraham Ormerod Medical Centre in Todmorden, West Yorkshire. And almost immediately, the first warning sign appeared. Shipman was discovered forging prescriptions for pethidine, a powerful opioid painkiller, and using the drug himself. In 1976, he was convicted of prescription fraud, fined, and ordered to attend rehabilitation treatment. The General Medical Council was informed. And then, astonishingly, Harold Shipman was allowed to continue practicing medicine. He moved to Hyde in Greater Manchester. He joined the Donnybrook Medical Centre. And his patients loved him. This is the detail that makes Harold Shipman different from almost every other serial killer in British history.
He was genuinely seen as a good doctor. He made home visits when other GPs would not. He remembered names, families, illnesses, and personal details. Patients trusted him completely. Families praised him. Neighbours recommended him to one another. The caring family doctor and the killer existed inside the same man so naturally that after a while they became impossible to separate. Patients saw compassion. Families saw professionalism. But somewhere beneath the routine of prescriptions, home visits, and polite conversations, Harold Shipman had begun treating death as just another part of the job. The method was simple. Devastatingly, terrifyingly simple. What made Harold Shipman truly terrifying was not rage, not chaos, not sadism in the way people imagine serial killers. It was control. Investigators and psychologists would later describe a man who appeared to enjoy absolute authority over life and death. His patients trusted him completely. Elderly people opened their doors to him without hesitation. Families believed every word he said. And inside that trust, Shipman occupied a position almost no killer in history had ever possessed. He was not hiding from society. Society protected him.
Some believed he saw himself as merciful. Others believed he developed something closer to a god complex, deciding who lived, who died, and when. Over time, death itself appeared to become routine to him, clinical, ordered, almost administrative. And because his victims were elderly, because their deaths looked natural, because the killer wore a stethoscope instead of a mask, Harold Shipman learned something horrifying. He could kill almost anyone he wanted, and nobody would stop him. Shipman would visit a patient, usually elderly, usually female, usually living alone. He would administer a lethal injection of diamorphine, which is medical-grade heroin. He would wait for the patient to die. He would then call the family and inform them of the death, making clear that a post-mortem was not required, since he had seen the patient recently and could certify the cause of death himself. He would sign the death certificate. He would enter the visit into his surgery computer records, and he would go home for his dinner. It was clean. It was clinical.
It was completely invisible inside the ordinary machinery of a GP's working day.
Elderly patients die. That is what elderly patients do. No one questioned it. No one looked twice. And the death rate among Shipman's patients, which was significantly higher than any other GP in the area, was noticed more than once and dismissed more than once by the local coroner, by fellow doctors, even by Greater Manchester Police themselves. And perhaps the most terrifying part of all was this. Shipman had already been questioned once before. Months earlier, concerns had been raised about the unusually high number of deaths among his patients. Detectives investigated briefly. Medical records were reviewed.
nothing happened.
The doctor returned to work. The killings continued, because nobody could quite believe that a trusted GP, a man who drank tea in his patients' kitchens and spoke gently to grieving families, could also be hunting them. Nothing was ever found wrong, until Angela Woodruff picked up a phone and called a detective who looked at a badly typed will and realized something was terribly wrong. On the 7th of September 1998, Detective Superintendent Bernard Postles arrested Harold Shipman at his surgery. Shipman denied everything. He sat through the investigation and then the trial with the same composed professional arrogance that had protected him for 23 years, certain, even now, that he was the most intelligent person in every room he entered. He was wrong. The typewriter in his possession matched the forged will. Kathleen Grundy's exhumed body contained fatal levels of diamorphine. His computer records had been altered. He had been retroactively changing the medical histories of his victims to suggest pre-existing conditions that justified their deaths. Every alteration carried a timestamp. Every timestamp placed the changes after the patient was already dead. The evidence was overwhelming.
On the 31st of January 2000, at Preston Crown Court, Harold Shipman was convicted of 15 counts of murder and 1 count of forgery. He was sentenced to life imprisonment with a whole life order. But almost nobody believed the number was truly 15. The subsequent Shipman inquiry, chaired by Dame Janet Smith, examined 888 deaths among his former patients over a period of years. It concluded that Harold Shipman had murdered at least 215 people. The real number, investigators admitted, would probably never be known. And perhaps the most disturbing part of all was this. He never confessed. Not once. He never explained why he killed. He never admitted guilt. He never provided a complete list of victims. Hundreds of families were left with uncertainty, forced to wonder whether the final moments of someone they loved had been natural or planned. On the 13th of January 2004, one day before his 58th birthday, Harold Shipman was found dead in his cell at HM Prison Wakefield, West Yorkshire. He had hanged himself using his bedsheets. He left no note, no confession, no explanation. The Shipman case changed British medicine permanently.
New rules for death certification, new controls on dangerous prescription drugs, new oversight of GP practices. An entire medical system rebuilt because one trusted doctor had spent more than 2 decades killing patients inside it without being stopped. The white coat hung in storage after his death. The stethoscope was logged as evidence. The needle was never found. And somewhere across Greater Manchester, hundreds of families were left to ask themselves the same impossible question. Did the person they trusted to save the life of someone they loved actually choose the moment they died? For 23 years, Britain feared monsters hiding in dark alleyways. They never imagined one would be carrying a doctor's bag.